Hello, everyone, and thank you for joining us. My name is Maureen Clark, and on behalf of Simpler, welcome to today's webinar, 2020 Vision, the Year in Review, and the Year Ahead. Donna Goestenkors and Leslie Foltz present today's webinar, brought to you in collaboration with Team Med Global and sponsored by Simpler. For those of you who may not know Simpler, we're an industry leader in governance, risk management, and compliance SaaS solutions that help healthcare organizations mitigate risk and ensure compliance. We also have an NCQA certified CVO that provides temporary or full-time assistance for services including primary source verification and payer enrollment. A few housekeeping items first. The dialog box on the right-hand side of your screen is helpful for a number of reasons. If you find it difficult to hear the presenter using your computer speakers, please call into the phone number listed in the audio section of the dialog box. We'll also have a live Q&A at the end of the webinar. Throughout the program, you could submit your questions in the questions section of the dialog box. Finally, the PowerPoint, NAM CEU certificate, and certificate of participation are in the handout section of your dialog box. So I just want to go ahead and repeat that. We have NAM's approval, so you can at any time go ahead and download both the PowerPoint and your NAM's CEU certificate from that dialog box area. Now, with great pleasure, I introduce our friend and today's speaker, Donna Goestenkors. With more than 43 years of experience in the medical staff services field, many of you may know Donna or have worked directly with her. And with that, Donna, I'll turn things over to you.
Great. Thank you, Maureen. Hello, everyone, and welcome to our closing session of this year's MSP Task Force Series. My name is Donna Goestenkors, and it has been my pleasure to spend 12 hours with you over the past year as my team and I have presented on a variety of educational topics ranging from credentialing to payer enrollment to healthcare quality to practice management and, yes, MSP wellness, because you are that important. All of these year's sessions, or I should say all of the sessions presented this year, have been delivered with the most sincere desire to help you in your professional and personal development that really will lead you to greater fulfillment and success. And I really do believe that you know that this comes from our heart. My co-presenter is Leslie Foltz. Now, to further demonstrate how awesome I really believe all MSPs are, Leslie had an emergency surgery about, really less than 2 weeks ago, but was insistent that she is well enough to be part of today's program. So Leslie, please extend to our listeners a warm, friendly greeting.
Hello, and thank you for including me on the webinar today, Donna, and I'm happy to be talking to all of you today.
Great. Well, please know that Maureen and all the folks at Simpler and TMG, we take great pride in presenting the highest quality educational and training programs that are relevant to industry information for absolutely every session that we deliver. And in fact, this annual year in review session and how MSPs can better position themselves as the new year approaches is a program I really look forward to building every year as well as presenting. It really serves as a natural blend of real life MSP working experiences through professionals just like Leslie, and it combines the information with global perspectives that I receive when I'm out in the field, not only from healthcare administrators, medical staff leaders, but also MSPs that I work with every day. Leslie and I want you to be in the know. We want to use straight talk with you, and that talk is going to help motivate you to really greater excellence. In today's program, we're going to identify 3 ways the work of the MSP has expanded over this past year. We're going to identify for you 5 leading competency gaps that we see in the field that we want MSPs to be aware of so they can begin to work and really resolve where these gaps are and look at 7 industry and healthcare trends that we know are going to be a realistic event. If you've not already been affected by it, it's going to happen in year 2020. And you have to ask yourselves, have you been affected by any of these with any of these trends? Because really, sometimes knowing that others have experienced something that you haven't yet or are soon to be experiencing can be very bonding. And that's one of the beautiful things about what Simpler hosts for us on these monthly webinars. We can really learn and help each other as we navigate these very uncertain waters in healthcare that we're all dealing with. So as we kick off our program, what Leslie and I really want to underscore for you is really the future is yours to create. So all of the things that you hear, some of them might be a bit uncomfortable, some of them might be even painful, but knowing that other people are experiencing things in a similar fashion, but together we have such power to change how we're going to approach our career and our life. So let's look at the year in review. And really, as you've heard me speak time and time, actually every educational program just about that I do, I talk about the MSP value, what you bring to an organization. And it really stems from your ability to demonstrate your competence, not only in the skills that we work and fine-tune and hone every day, but it's also about how we get along with others through our emotional intelligence skills, and then using our skills, using our personal development or emotional intelligence. Then we want to make sure that we package ourselves in a professional way that really makes you stand out from the crowd. What is it that you're offering within your organization or external, if you're going to be pursuing perhaps one of your goals is to look for a different job? We really want for you to understand that it really is a three-prong approach. Your skills, your interpersonal ability, and then how you package yourself from a career standpoint. So we're going to go through the next slides very quickly because you've seen that how we measure ourselves as MSPs, you've seen this previously. The knowledge that we acquire, the skills that we practice every day, and then our ability to demonstrate those skills and our effectiveness. And whenever I'm talking to people in our profession and whenever I hear from them their success stories or what they perceive as failures, they fall into these three buckets. How efficiently they are able to perform their skills, how effective they're interacting with others, and are they able to really have choices in their career? These are all of the core efficiency management competencies that have been identified by you, our listeners. These are evaluated on an annual basis. So know, as you download this program, you can refer to these. These might identify some of your areas of weakness in your current place of employment or your current status of work. These are interpersonal or personal core competency areas that, again, I hear from MSP director and above, as well as healthcare and medical staff leaders. These are things that help set one MSP apart from the other. Not only the technical skills, but how well they're able to manage stress, how well they embrace change. Are they looking after themselves? Can they negotiate conflicts, and do they branch out when they have questions and really network with not only their MSP colleagues, but external sources as well, or internal administrators or stakeholders that can help them succeed within their organizations. And then, again, this career power, again, these are core competencies that have been proven time and again in things that I work from a coaching perspective and a career coaching perspective with my colleagues. So you can look at those really on a first blush when you download this program. All of those core competencies that no one else in our field has ever categorized or presented it this way in a structured manner before. So when we look at how our role in 2019 has changed and expanded, I really would like Leslie to kind of drill down and share. Sometimes we get so busy in our day-to-day lives, right? It's hard for us to kind of look reflectively and go, gosh, yes, these are things that I can start putting on my resume about achievements that I've been able to succeed in. So Leslie, could you take us through this next portion of slides describing the expansion of our roles?
Sure, Donna. Thank you. So one of the areas that we have expanded is our onboarding process. I still continue to hear our peers discussing the onboarding process to make it as smooth and efficient for the physician and for advanced practice professionals. One of the areas that we need to continue to do when we're developing this process is collaborating with practice managers, physician liaisons, recruiters, enrollment specialists, facility managers, security officers, IT, the list goes on, while keeping in mind that there are corporate policies, procedures, regional and division policies and procedures, and local policy and procedures that we have to follow and to bring these physicians and advanced practice professionals on. Then we have OPI, FIPI, peer review, and behavior activities. OPI and FIPI have been around for a while, but I still hear from our peers there's still discussion on how to develop really good, strong processes for OPI and FIPI. One of the areas that we need to people that we need to collaborate with is medical records, quality management, risk management, physician leaders, attorneys, HR, board of directors, and that list goes on as well. Again, we need to keep in corporate policies and procedures in place, and regional and divisional policies and procedures in local. And we have to make sure that we're following peer review laws and keep updated with the changes with peer review laws. So those are some of the areas where our scope has expanded, and I see that it's still going to continue to expand.
And Leslie, one of the things that I see frequently in the field is the role of the MSP in the onboarding process. Mm-hmm. Surprisingly, many organizations that I visit, that MSP is more of an adjunct role, meaning they'll call and check on the status of an application, meaning the recruitment department may call, but the MSP is not always involved in that onboarding process, which is sort of like a major gap from my perspective, because we're the ones, the credentialing specialists within a hospital are the ones that are really making that process happen, and they know kind of what the status and where some of the delay marks have been, so they can really be valuable partners and valuable voices at that table. So again, an opportunity as we look into 2020, if you have a formal, or maybe it's still in the process of being developed, please let your voice be heard and be part of that structure, so you can really bring the need of that practitioner to the fold of all of the stakeholders involved in that practitioner's involvement in that organization.
And I agree, sometimes the MSP is actually the leader of that process.
Love it. I love hearing that.
Yes. So another area that we're expanding is enrollment and managed care. Those two, they seem to go hand in hand, and I see that a lot of integration of the processes with the two, as managed care does all of the contracting for the payers, and then enrollment does all of the enrolling for the practitioners. So I see a lot of integration of their processes, which kind of leads to the software. You need to have both managed care and enrollment working together to develop these processes when it comes to the software. And you can even add credentialing into that, because you end up integrating those processes by collecting the same information. So all three of those can actually work hand in hand, which brings us to the lean processes. Healthcare is looking to cut costs overall, and by developing the lean processes, you're eliminating duplication. And I still feel that, and I still hear this, that's being talked about often among our peers and in all across healthcare. Increased service line mergers in health systems. We do still see consolidation with healthcare systems. I know that I was just talking the other day, or I read the other day, that there were 71 mergers in Q3 of this year, of 2019, compared to 68 of 2018, and they still project that that is going to continue and grow. Systemization, I do see health systems increasing their service lines and even actually building hospitals. I see cancer centers, ambulatory care centers, urgent care centers. I've been reading a lot about how they continue to grow. So we're seeing a growth overall in that. So with those happening, we have a change in our work team. I went to a conference, it was last year, and they were talking about how it was quite a big health system, but they were combining their staff into teams. And so that actually leads to a change in your job responsibilities as well. Sometimes you will see there's site coordinators, and then there's credentialing specialist, and then enrollment specialist. Sometimes you see credentialing and enrollment the same. They cross-train and do each other's duties. So I think the job responsibilities are going to continue to change, and I'm seeing that actually often. I talked to another peer who they did a merger, and they actually ended up building a CBO after that merger. So job responsibilities had changed there.
Before, I'm sorry, go ahead, Leslie, continue.
And then with all of this combined, you see a change in the culture. All of a sudden you have a bigger staff and bigger teams, and different personalities, and you have to learn to adapt. People have different ideas. So adaptability in the culture, I think, is very important when it changes.
Leslie, could you repeat that statistic on the number of mergers from the research that you did for 2019 to date?
Yeah, there were 71 mergers in the third quarter. I haven't seen anything in the fourth quarter yet, compared to 68
That's compared
mergers.
compared to 68, you said, in 2018?
In 2018, yes.
Okay. Yeah. And the reason I asked you to repeat that, because many of the people who are participating in this webinar have heard me say that based upon research that I did relative to mergers and acquisitions, there was a prediction by a healthcare leader that in year 2030, 30% of hospitals will be closed. And that's one of the reasons why Leslie and folks like her and we really do want to share information so MSPs feel that they have the power, knowing that they perhaps have some decisions that they have to make about their career. Now, I say this not to frighten people, but sometimes we have to know what's happening out there. And again, to validate what your research was, Les, my research also said that mergers and acquisitions among healthcare organizations will continue at least for another 5 years, they're projecting. So those 2 points that I just made sort of are running on parallel tracks. More than likely, unfortunately, it will be some of the more rural hospitals that will be closing. So that's a disadvantage definitely for the communities of those areas, but from the view of the MSP. There's so many other options for us. So let's just keep our minds open on where actually these changes are happening. But as Leslie is pointing out, the facts that she is describing to you, these are just things that have happened in year 2019. So more to share, definitely.
Donna, just one more thing to add is I'm from up north, way up north, and they have been talking about some of the smaller hospitals closing up there, but I have also seen some big corporations that have bought some, they're now part of that corporation, some of the hospitals. So we may see some of that going on as well too. So just
and we will be addressing some of those trends that we're seeing, again, that are currently and will continue to impact MSPs in the latter portion of our program.
Okay.
All right, so now we heard how our roles have expanded over 2019, and some of you, they may have started, even a couple of years prior to 2019, but you get the essence, right, of how our workload continues to increase. With that workload, we know that there are lots of opportunities for MSPs, but I also can identify for you that there are indeed specific gaps in competence that MSPs admit when they reach out to me regarding their career development, or healthcare administrators or medical staff leaders are saying, something's just not right in that department, Donna. Could you please do an assessment? So again, this is insider, straight talk information. It's not meant to hurt anyone's feelings. This is real stuff, and we have to, in order to change, we have to know what's happening out there so we can decide, is this relevant for me and what can I do about it? So the first competency gap that really Leslie and I, when we kind of pooled our thought process, it begins with competence. How do we know where our gaps are relative to our skills or interpersonal skills if we don't do an assessment? You can go online, and there's all kinds of self-assessment tools, but relative specifically to our industry, you go back to those first competency slides that I displayed, and you can do your own informal self-assessment just using that. But the three areas you're going to want to be focusing on are skills. Are you truly technically sound in implementing automation into your processes? Are you having a clear understanding that basically everything that you're doing within your departments is managing a project at some point? And those are just two examples of competencies relative to skills that healthcare administrators and human resource departments are looking for. With regards to your assessment in personal development, we've done a number of programs on emotional intelligence. It's kind of like the hot button right now. You will continue to see Simpler and TMG deliver even more programs on emotional intelligence next year, but that's how important emotional intelligence is. How well we're able to identify why we react in situations the way we do and have a greater tolerance or understanding, especially when we have a multi-generational workforce, to better understand why that person is behaving in that way. It may not be as toxic as what we initially think. And then to be able to really deal with conflict within our own work teams. When you're sometimes assigned to projects and a couple of your team members really aren't the worker bees that we are, that can create conflict. So being able to be skilled in understanding the nuances of both of those. And then again, when you are looking at other opportunities, how fine-tuned, how sharp are you in interviewing skills, especially for many of us who haven't interviewed in 10 years or more. Things have changed significantly. Just like doctors are applying digitally, well, that's kind of what's happening to us as MSPs. We're being expected to complete our applications online as well. So that's our first area of gap. In order for us to be excellent in the work that we do and the deliverables of our service, we have to understand where our strengths and where our weaknesses lie. Then our next gap, okay, we know our strengths and weaknesses, but do you really have a career plan? Are you satisfied with where you are? And that's wonderful if you are, but there always should be goals that you're reaching toward. And if you don't have a career plan, or if you're not totally satisfied and you think in year 2020, you may be looking external to your current place of employment, have you started building your career portfolio that you can present to a potential employer and kind of wow the socks off of them? So when we're talking about a career plan, setting goals and really taking action, because as you've heard many a time, goals without action are just words on a piece of paper. They really have their power when we take action.
Donna?
Yes.
So also going back to the other slide with the negotiation skills, I just wanted to add, it may just, when you're negotiating for a position, it could just be that you want to get certified or access to education. It's not always a monetary thing. So and I worked in HR before, and I also have talked to other HR professionals. They actually expect you to negotiate when you're getting a job offer, just to add that little tidbit.
Ooh, I love that. That's very empowering too, because sometimes we can be a little nervous, but hey, knowing that HR is expecting that, okay, well, that's exactly what we can do then. Okay, other gaps pertain to financial restraints, and this is true, right? We're being asked to do a lot of things, and sometimes we don't have the approval or the budgeted dollars to travel, to obtain our education or our training from different platforms. And whether or not you're certified, I think that is a decision maker for you, the culture of your organization. Just like a practitioner becomes board certified, not everybody is, but that offers another level of competence for that practitioner when they can produce evidence that they're board certified. Well, the same holds true, right, with MSPs. Not only certification, but I'm seeing more and more higher educated MSPs out in the field. And all of these things are wonderful in the evolution of our profession, but you have to decide if personally these are goals that you want to offer. But we recognize that those gaps could be preventing us from doing what we know will help us excel. And so then that becomes a decision point for you. Can you find resources through another means? Can you rebudget from a personal standpoint because your company is no longer paying for your dues or no longer paying for your local or state membership? So all kinds of factors that we want to bring to people's attention. And so you're not feeling like you're the only one who hasn't been approved to go to a conference. That is happening. When we're talking about competency gaps, we're also looking at our time investment. What are the increasing responsibilities that are taking us off course, and the number of staff that we have to work with, and creating that work-life balance, and then really the burnout. And all of these factors really are gaps that we have some control over, the work-life balance. And if you know that you're constantly and you're at a point of burnout, or you're constantly being expected to deliver, and there's no sort of mid-range or no sort of neutralization of that becomes a time for you to have those critical conversations with the powers that be, and perhaps look to see if there's other opportunities for you. But these things really do prevent us as MSPs in being able to move forward. None of these things are easy on their own. Again, the information Leslie and I are sharing with you, this is meant to be power for you, so you can be making informed decisions about what's next.
Donna,
When we're looking, yep.
Sorry. I know somebody for the certification last year. She was telling me about all of these apps she has on her phone, and these are for the tech savvy people out there. She actually has one app where every time she spends money, it rounds up to $1, and she ain't managed to save $1,000 in 1 year. Her facility actually covered her certification, but not the education portion, so she used that to cover her education portion. And then she also has another app on her phone that she got $100 off a plane ticket. So when you're talking about investing in yourself, I thought that was a pretty creative way to make sure that she got her education, and she ended up getting certified. So there's some.
One of the questions at the end of our program is going to be, what was the name of those apps?
Exactly. I know. I can get those. Yes.
Okay. And we will certainly make that information available. You can contact either of us directly, but I just know how the mind of the MSP works. So yes, there are some of us who will definitely want that information. But I think your point really, Leslie, is that we really, with all of the technology that's available to us, we have the opportunity to be as creative and resourceful as possible. And that was a wonderful segue, Leslie, actually into our last gap. We know that MSPs, we take great pride in the work that we do and the quality of work that we do. And sometimes it's hard for us to either find the time or to reach out and ask people for help. So seeking out mentors so we're not reinventing the wheel. So important. They're going to help you identify, some shortcut tips or some pitfalls to avoid as you move forward in your career. They'll be able to offer referrals, just like Leslie did about these couple of apps that someone used that actually saved them money that they could reinvest into something that was beneficial to their development. And I feel that one of the things from an interpersonal perspective that I see most destructive when I'm in the field working in CVOs, physician offices, medical staff services department, and the like, is that when people are critically destructive about another team member. Because our job truly as professionals is to try to work together and find some kind of common ground that we can build and help each other, kind of lift each other up. But we all have frustrations. And so what I really recommend is that you find a source that you can vent to in a healthy way, meaning you're not being destructive by criticizing the boss or your work partner in a way that creates such negative energy, but you find a way that you can vent to somebody who's not going to judge you, who's not going to try to fix it unless you ask them to, where you just need to get the power of that particular incident off your chest. And so I always call that healthy venting. Also, making sure that when you seek out mentors, you're looking for people who can really give you honest feedback, not just tell you what you want to hear, but say, hey, Donna, the last time you gave that presentation, you kept referencing medical staff office. Now, remember, I've been around a long time, and so I sometimes still get tripped up saying medical staff office rather than medical staff services department. So we're all works in progress. So we don't want to be too hard on ourselves, but making sure that when we're asking people to kind of evaluate or critique us, you're going to get reliable information that you can determine that if it's valid and that you want to build and improve upon. And then seeking out mentors also will help you because they're going to know potential openings in other positions or other organizations. So these gaps, what we've identified, these we recognize are barriers, but these all have solutions. And I think that's really what Leslie and I were wanting to convey to you. We were able to identify these 5 things because we recognize that these are things that people are saying to us frequently. So we wanted to make sure we address them so you can, again, find solutions that perhaps we didn't offer through this portion of our program. Leslie, anything else you want to offer on this slide?
No, I think that exactly what you were saying, the mentors are so important, especially when you're just starting out as an MSP. And actually when you're an experienced one yourself, reaching out to mentors, it's a really good resource to help you get through some of these things that you face daily or monthly or even yearly. So definitely.
Don't struggle in silence. There's so many people like Leslie and I who are really wanting to help you. So just pick up the phone or send us an email and ask us. All right, the last portion of our program I feel is honestly the most empowering. Again, this is based upon research and interviews that I've done with MSPs and healthcare administrators, and it's through Leslie's own work experience. So we share this with you so you understand what's happening in our industry and how we in 2020 can position ourselves to a point of greater power. So let's look at these 7 trends. First one is healthcare in general. What you're going to see in your own organizations is that there are going to be more and more patients admitted, and the patient is going to be the ultimate customer. They are changing how healthcare is being delivered. A lot of it through that patient satisfaction survey, but there are more and more self-checks that hospitals in particular are doing to reach out to patients and patient families to validate how has the experience been for so far. Is your PICC line dated? That's really important because infection, that's a great site of infection. So all of these double checks that are happening, I know might seem redundant, but truly they are improving that patient's experience and overall health. There's going to be increasing technology. Okay, we thought we've heard this enough, right? Technology's been around a long time, but it's going to continue to evolve, more and more innovation, not only administratively, but clinically. So if we're a little apprehensive about understanding all the depths of our software for credentialing or payer enrollment, please use now the time to get your training, to get your education, because it's going to become more and more important as you move forward in your career, how adaptable you are to these different technology environments. Because of technology, we're going to have more and more access. And I'm not just saying MSPs, I'm saying healthcare in general, but MSPs too. We're going to have more and more access to information. So we have to be the discerners of information. We have to make sure that what source we're obtaining this information from is indeed valid. I've already addressed innovation. There's going to continue to be increased costs of healthcare that's being provided, for services that are being provided, and the number of uninsured patients are going to continue to rise into 2020. The physician shortage is going to continue, and we know just from previous webinars that physician shortage, it behooves all of us to really reach out with compassion and greater understanding to physicians who are not maybe technically as sound, and get them the training that they need in order to be efficient, more efficient. We don't want to lose good practitioners, and we know with the activation of the electronic medical records, the reality is physicians would rather resign, and I'm talking about senior physicians. And I'm not saying close to retirement, but senior physicians would rather have resigned than to learn that software. And organizations across this country were not addressing the need to help mentor these physicians properly. So looking at ways that we can be more sensitive to physician needs, and that's kind of the circle, right, on how I joined medical staff services. The physicians, the needs of the physicians were of utmost importance. And this is my prediction that there's going to be more outreach to physicians too. We can't change technologies that's dragging all of us forward, moving all of us forward, but how we provide resources to practitioners is going to be important. And they look to us for that voice of reason, calmness, and just support. So knowing that physician shortage is a reality, it's going to continue. There's going to be more practitioners that are nurse practitioners, more advanced practice practitioners filling in those gaps. And they certainly have a value in our industry, but from an MSP perspective, we have to have greater understanding on how to credential these practitioners. Decreasing reimbursements, that's real. Fewer and fewer dollars are going to practitioners and organizations for services that they are providing. Why is that? Well, because the healthcare field and the government has put in stronger expectations with regards to performance. So reimbursements are going to be based on performance, and we're going to be expected to understand the metrics that are being developed or delivered to practitioners so we can, again, be their support. And the role of the organized medical staff, and I know I've been around for a long time, it makes me sad that the traditional organized medical staff is changing, but there are also some exciting potential and exciting new models that I'm seeing there, but there's pain associated with that traditional medical staff going away. Pain from physicians, pain from people like us, the medical staff people who've been in the business a long time, and we have seen kind of the deterioration of the organized medical staff. It doesn't mean that what's evolving toward can't be just as rewarding, but right now we're kind of in this mucky stage of uncertainty. When we're talking, we touched on that about how our role in 2019 changed, but one of the trends again for 2020 is going to be mergers and acquisitions continuing, doing more with less, having staff that are experienced and then combining those staff with people who have absolutely no experience, and how do we properly mentor those people. Knowing that there's a merger, actually, an integration, I should say, an integration of enrollment services and credentialing services falling under one umbrella, and then the ongoing centralization that is happening within organizations. And the expanding healthcare services, that's number 5. Expanding healthcare services, it's really about integrating our medical staff, developing an internal CVO, lean method, which Leslie already talked about. And that's something that more of our colleagues are reaching out to me saying, Donna, can you please hook me up so I can better understand lean methodology? Outsourcing, this is real, and this is kind of scary because remember we're kind of in this muddy area. We know that IT outsourcing has happened for, over 20 years now probably. I have now, just last week, I think I updated this last week. Outsourcing of accounts payable, medical record duties, and payroll are now being outsourced to the Philippines. So keep that in mind. If organizations can outsource these services at a lower rate, so they have more operating income in which to provide their services more equitable, they're going to be looking and evaluating that. Now, I've only heard one organization who's outsourcing to the Philippines, but I imagine their marketing is going to continue, so kind of just stay tuned for that. Another reality, and any administrators that are on this webinar, again, none of this is meant in an attacking way. This is feedback that I get from MSPs, that MSPs have a strong sense, and this is an overgeneralization, it's not across the board, but they have a strong sense that administration really doesn't understand the value of what they bring to the organization. Part of that is our job, because we must, as MSPs, be able to speak our value, but also there's learning opportunities for administration that they become more knowledgeable, not in our day-to-day work, but being able to listen a bit more intently, and so we as MSPs feel more engaged, that they are more engaged in the work that we're doing, so our quality of product that we take such pride in is not going to be compromised.
I hear that a lot as well. I hear that a lot as well too, Donna, with administration not knowing what MSPs do at all sometimes. So providing that education, I think, is extremely important. If you can get someone, to support you for that. So.
Well, Leslie, why don't you take the remainder of our trends for 2020?
Okay, sure. So technology, we've talked about a lot today with credentialing management, privilege management, enrollment management. These are all areas where technology is becoming the way to do these things. Credentialing, there's lots of software packages out there that do all of these things. So you're looking at a lot of programs that are getting bigger and better, helping us to manage all of this. So the performance improvement management, it's getting better and faster, the technology. I saw from one peer who said there's still a lot of manual aspects to the technology, but it is better and faster, and you get a better turnaround time. And it's easier actually to review all of these areas. And analytics, you actually get you can get your trends, so you can do performance improvement projects. So I still see technology growing for all of us at MSPs as well. Telemedicine, I've been doing a lot of reading on telemedicine these days. When you have telemedicine in your facility, you have policies and procedures that you need to build and processes. Telemedicine is definitely growing from just managing apps on your phone to calling your doctor on your phone. How is that going to play into the healthcare industry? I'm seeing this grow, especially for rural areas. It's a positive thing. But I still don't see a lot written about how that's going to affect us in the healthcare industry, because you have enrollment and payer policies and procedures and our standards. So I do see it growing more, and I think you're going to see a lot more coming down the pike as far as how that is going to affect us in the future. Locum tenens, that's another area, especially for rural areas, and with the physician shortage. You have vendors that you work with. That can be a little intense. You have lots of vendors that you can select from staffing agencies to agencies that just deal with locum tenens. You have shared contracts with key stakeholders. And then the accountability of locum tenens. We have to, in healthcare, they look at all of their performance. How are you accountable when you're using a locum tenens agency? So these are definitely trends that I see still continuing in the future. And workplace environment, you hear that a lot now, and it kind of goes back to the work-life balance sort of. Safety in the workplace, and in the generational workforce. I wanted to say something about the generation workforce, sorry. I have read a lot of articles and I've heard from a lot of the different generations, and as we seeing more generations moving into the workforce, they're very technology sound, but they also have different expectations, I think, than what we did in the older generation. They don't want to be stuck in meetings. They don't want to do a lot of paperwork. So technology and the growth of that is really important as time goes on. Tools, having the tools in our environment needed to do our work. Teamwork is very important these days. You're seeing a lot of not just internal, but external even, as we mentioned before, with practice management and enrollment and physician liaisons. Teamwork is extremely important in healthcare industry. Collaboration, seeing a lot of collaboration with team members, internal and external. And then systemization, job descriptions and job titles and salaries, education funding and processing. You see a lot of changes, I think, with the job titles these days in the healthcare industry, and it depends on the smaller versus the larger industries. You have corporate that is a lot different from a smaller industry with job titles. And so
I would like to, I would like to add to that again, because the feedback I get from the field, MSPs are feeling a little bit stuck relative to this constant centralization and systemization. We all get it. We recognize that there has to be some baseline in how processes move forward. When it comes to a person's job description, MSPs have expressed to me that they feel that their position is not really considered based upon the work that they're doing. They're just meeting some corporate category and they're placed in there. So the personalization of that particular job is sort of being, I want to say, neutralized, or it's kind of made more vanilla. It's not as individual as what that worker is actually doing. And that's been frustrating because they feel that they are kind of stuck in asking for a raise. Oh, well, no, sorry, it doesn't meet that job classification. Or when they're asking for a job title change, well, no, you really fit into this area. All of the other facilities within the system are in this job title. So people are feeling stuck in that way. And so again, how do we combat that? We combat that by the quality of work we deliver and making sure that your value is expressed with your spoken word and with your behaviors. You have to find ways that is going to set you apart from your counterparts, because otherwise it's easy for us to feel like we're kind of like a widget on an assembly line. You find satisfaction in the individual work that you're doing. And so that's really, again, what Leslie and I are attempting to do through this webinar, is to help you understand what power moves you can really integrate into your work environment. And it really is about your assessment, making sure you have a career plan, embracing change. That's one of the biggest things I hear from healthcare administrators is, gosh, I keep asking them if there's an easier way to do this. Are there other new softwares available? And the answer is no, this has always worked for us. And administrators don't want to hear that. They want to hear, hey, I've done some research and this might be a viable option. So knowing that change has to be part of your vocabulary and part of your behavior. Knowing that what we used to consider as a possibility or maybe as a non-possibility, you have to look at it with a different pair of eyes and say, okay, I never had to do payer enrollment before, but oops, I'm hearing that there's lots of integration of that. So look at these possibilities. Think about your role in your organization in a different way. Seek out resources like these webinars, like the softwares that are made available to make our jobs easier. Network, and then ask questions. Make sure you seek out your resources, ask questions, take action. You want to take risks and always be prepared, because that statistic that I referenced to you earlier in the program, by year 2030, 30% of hospitals will be closed. None of us, me, Leslie, none of us know what's around the corner. So we want to give you the tools and the power to make decisions that are going to be best for you. So with that, we're going to leave you with a power thought, because this does conclude our program, but we have some good pieces of additional information. So I hope those of you who can stay with us will do so. We also want to bring forward any questions. So I'm going to ask Maureen, while I reveal the next couple of slides, Maureen, would you please kind of organize our questions for our group, for our listening group?
Absolutely.
Great. Well, Leslie and I want to leave you with this power thought, and we're doing this on purpose because this is what we want you to think between now and January 1st of 2020. Think big, play big, make big decisions, because you really are a big deal. Leslie and I know that the work you do is a big deal. So reframe how you've been thinking about yourselves, because we value what you bring to this organization. We want to say Merry Christmas and Happy New Year, definitely, and Happy Holidays too. We want you, because this is a time, the holidays is a time of celebration. We want you, if your schedule can accommodate, for you to participate in the final webinar series sponsored by Simpler, December 17th. This is part of the Dr. FBI series, and it's really about celebrating the role of the MSP. And we call it celebratogy. So that's for you. All right. We're going to be releasing, meaning Simpler and TMG will be releasing soon our 2020 schedule, so you can begin marking your calendars. That should be released within the next couple of weeks, so stay tuned for that. Maureen, did you want to touch on the upcoming engagement conference?
Absolutely. Thank you, Donna. It's short notice now, but on December 11th through 13th, Simpler will be hosting its final Engage conference of 2019. We'll be in Nashville, and you can find more details on the Simpler website. To knock out a couple of the questions that we have in the box, we have questions about past webinars and also future ones. You can go to simpler.com/resources or teammedglobal.com. You'll find both of those in your PowerPoint deck. And since we're short on time, I'll shoot right into a couple of questions, Donna and Leslie, if you don't mind hanging around a little bit. First one, great. The first one is a portfolio was mentioned earlier on in the program. What would a portfolio contain?
Portfolio would include your job description, your resume, your biographical sketch, a professional picture, an accomplishments report, and a performance profile. And you can put those documents together in whatever fashion you like, electronically, in a 3-ring binder, in a pocket notebook, whatever works for you.
Great. Are there specific questions or reasons that should be given to management to convince them to allow your attendance at various conferences? I realize NAMS provides information, but they have not responded positively. Any tips you have?
Leslie, you want to take that one?
Yeah, sure. I guess with us, I guess it depends on what your facility that you work with. The first year that I worked at the facility I currently work at, the medical staff actually paid for us to go because they realized how important the education piece is. I guess really just writing down things on your own, the benefits of going and how it's going to help you and help the facility, because the knowledge that MSP holds, as we've talked about, is very powerful and powerful for your organization. If you write down some of those things, that why you hold so much power and how important it is, maybe that would help, and you present that. If you have a manager, present that to your manager. I know that there is something on NAMS, maybe combining it even with that. I think that's
I have a
one
couple
suggestion.
suggestions too. A couple suggestions I'd like to offer is any flyers that are coming through regarding these webinars, as an example, present that so they understand that this is not just, a social gathering. Yes, we do get a benefit from when we can meet electronically or face-to-face, but having them look at the objectives, doing benchmarking in your local area. How many of your colleagues are allowed or have been approved from a budget standpoint to attend programs? And I also recommend that, similar to what Leslie said, you put together a proposal as far as the benefits, what can be realized, because the organization wants to know what's in it for them. What are they going to get out of this by your attending an educational program?
And reaching out to a mentor too may help, as we talked before, with ideas.
Okay, Sandra and a few others have asked professional development questions that I think may take a while, but we encourage you to use the contact information in the spread PDF for those types of questions. So we'll end on one sort of specific one. Has anyone had any new providers being credentialed with a locum compact license?
No.
Definitely have heard of people, but I'm not sure that that's a question. I mean, there's no question in there that I can answer. It sounds like they're just wanting to know if anyone else has experience in that. So I'm sorry, I can't provide any more information.
All right. The next, we got one more, I think, short one. Can payer enrollment specialists be certified with NAMS?
NAMS does not offer a certification program for payer enrollment. They offer educational programs, but in April of next year, TMG will be rolling out a education and training program specifically for payer enrollment.
All right. Again, I encourage those with some longer, more personal questions, please feel free to reach out. Otherwise, thank you, Donna and Leslie, for a wonderful and informative presentation. Thanks, everyone, for taking time out of your day to join us, and I hope you all have a great day. This concludes the program.
See you next year.
Thank you. Thank you.